So hey guys, my name is Rishabh Singh, a first year medical student from Eastern Medical College and Hospital, Comella. Welcome to my channel. If you're new here, so please go and subscribe to my YouTube channel. I try to provide you some educational video related to MBBS. I hope you will gain or acquire something new at the end of it. If you like, don't forget to subscribe, like and comment below. Guys, welcome to my YouTube channel. Today's topic is vermiform appendix. So in this video, I'm going to discuss about the vermiform appendix. Coming to today's topic, vermiform appendix. It is narrow worm-like diverticulum which arises from the posterior medial wall of the cecum about 2 cm below the ileocecal junction. So this is the vermiform appendix, which is also known as the vestigial organ of the human body. Now coming to position of appendix: retrocecal, pelvic, subcecal, post-ileal, paracolic and pre-ileal. Retrocecal is commonest and second most common is pelvic. As you can see in the diagram, these all are the position of the appendix, in which you can see retrocolic, it is 12 o'clock position, which is 65.28%, and pre-ileal, which is 1%, post-ileal, which is 0.4%, it is 2 o'clock position. Now you can also see the terminal part of ileum, and you can see the promontoric position, which is 3 o'clock position, it is less than 1%, and pelvic 4 o'clock position, which is 31.01%, and you can also see paracolic or 11 o'clock position, which is about 2%, and mid inguinal position, which is 6 o'clock position, it is also about 2%. So these all are the position of the appendix. Coming to artery supply of vermiform appendix: blood supply, arterial supply by appendicular artery, which is functional end artery, and it is a branch of lower division of ileocolic artery, and venous drainage into superior mesenteric vein. As you can see the diagram, this is superior mesenteric artery, this is superior division of ileocolic artery, this is inferior division, this is superior division, this is inferior division of ileocolic artery, this is anterior cecal artery, this is posterior cecal artery, and you can also see this is the appendicular artery which supply the appendix. Now what do you mean by end artery? The artery which has no precapillary anastomosis is called end artery. The central artery of the retina is also called a true end artery. It is an example of true end artery. Coronary artery is also a functional end artery throughout, because it has this anastomosis. When this block is main branch, they won't be able to maintain the collateral anastomosis, so that's why it is also called the functional end artery. Now coming to nerve supply, as you can see by sympathetic and parasympathetic, from T9 to T10 segments, that is thoracic 9 to thoracic 10 segments of spinal cord through celiac plexus, and parasympathetic by derived from the vagus nerve. Now coming to the part of appendix. Appendix consists of base, tip and the body. Clinical importance of appendix: inflammation of appendix, it is called appendicitis. Basically the thrombosis occur in the artery, then there is an gangrene at the tip of appendix because it is less vascular. Now a question is asked in the exam, in the Viva exam, that appendicular artery enter through which? So appendicular artery enter into appendix through mesoappendix. Now coming to importance of blood supply of vermiform appendix. It is more prone to gangrene at the tip of appendix because it is least vascular. As you can see, it is less vascular area, or the tip of appendix is less vascular. So that's why the gangrene at the tip is most common. What is most dangerous variety of appendix? It is pre-ileal variety is most dangerous because inflammation from appendix will spread to the general peritoneal cavity. So this type of appendix variety is most dangerous. Now coming to development of appendix, it develops from the lower part of the cecal diverticulum, which arises from the distal line, the U-shaped loop of the primitive midgut. So this is the development of appendix. Now coming to peritoneal relation of appendix. As you can see the diagram, the mesentery is connected. As you can see, also see it is ileum. This is mesoappendix. Through mesoappendix, appendicular artery enter the appendix, and you can see the appendix. So these all are the peritoneal relation of the appendix, the mesentery and the mesoappendix. Now coming to lymphatic drainage to ileocecal and appendicular nodes. The lymphatic drainage occur by through ileocecal and appendicular nodes. Now coming to histological structure of vermiform appendix. As you can see in the diagram, it is mesoappendix, it is longitudinal muscle, it is circular muscle, it is small lumen, it is few and short crypts, it is lymphoid nodules with the germinal center. As you can also see the serosa, the interrupted muscularis mucosa. So this is the histological structure of vermiform appendix. So the histological structure from outside to inside is serosa coat, which derives from the peritoneum, cover entire tuber except the border of mesoappendix. Muscular coat, it consists of outer longitudinal layer and inner circular layer of smooth muscle. Now coming to submucosa, it contains loose areolar tissue and numerous lymphatic follicle. Mucus, now coming to mucous membrane, consists from outside to inward is muscularis mucosa. It consists of basically three parts. From outside to inward it is muscularis mucosa, lamina propria and lining or surface epithelium. Now what is the surface epithelium of appendix and of whole large intestine? It is simple columnar epithelium. It also consists of numerous goblet cells which secrete the mucus and occasionally enterochromatophin cells, and it is also devoid of villi. Villi is not present here, so there is no absorption. We have the goblet cells. So basically goblet cells are the unicellular gland that secrete the mucus. Its main function is to secrete the mucus, and surface epithelium is columnar, simple columnar epithelium. Now coming to the functions of the large gut. What are the functions of large gut? Absorption of water and electrolyte, 500 ml per day water reabsorption, formation, storage and expulsion of feces, and the synthesis of vitamin B12. In its mucoid secretion, there is immunoglobulin A. Through it prevents from terminal part of ileum to cecum unabsorbed residue of food invasion of microorganism. Then semi-solid fecal matter form. Then it gets solid due to the mucus secretion. Solid fecal material unable to injure the mucosa. To prevent the mucosal injury, large intestine is lined by numerous goblet cells which form a jet layer. In lamina propria, there is a presence of gland called crypts of Libacun, in which goblet cells are present. Mucosa form the temporary mucosal fold in the histological structure of the large intestine. Now coming to difference between the small intestine and the large intestine. As you can see, small intestine is, there is permanent mucosal fold called which is called plica circularis, and there is temporary mucosal fold. Now villi is present in small gut and villi is absent in small gut. So small gut have more reabsorption than the large gut. Now coming to clinical condition related with appendix. Acute appendicitis, recurrent appendicitis, appendicular lump, appendicular abscesses, mucoli of appendix, diverticula of appendix, neoplasm of appendix, which can include carcinoid tumor or adenocarcinoma. So why appendix is called abdominal tonsil? The submucosa coat of appendix contains numerous lymphatic follicle, which is a source of lymphocyte, and it strengthens the immunity of the body like tonsil. So it is called the abdominal tonsil. Now why appendicular pain is felt around the umbilicus? Pain is caused by the appendicitis is first felt in the region of umbilicus. There is referred pain. Note that the fact that both the appendix and umbilicus are innervated by thoracic tense segment of the spinal cord. With increase, the inflammation pain is felt in right iliac fossa. This is caused by the involvement of parietal peritoneum of the region. Now the question arises, why appendicular pain radiates from umbilicus to right iliac fossa? So appendicular pain radiates from umbilicus to right iliac fossa because of same segmental innervation, that is T10 sympathetic nerve supply to the region. Now coming to McBurney's point. It is represented by a point at a junction of medial 2/3 and lateral 1/3 of a line extending from umbilicus to the right anterior superior iliac spine. As you can see in the figure, from umbilicus to the right superior iliac spine, this point is called McBurney's point. Its clinical importance is McBurney point indicates the maximum tenderness in appendicitis and appendectomy. The incision for appendectomy is based on anterior abdominal wall. The appendix is delivered through the wound and cut at its base and removed. So this completes our lecture on appendix. I hope you like this video. If you like this video, then don't forget to subscribe to my YouTube channel, which is MBBS Studies with Rishabh Singh. Please like, comment, share and subscribe to my YouTube channel. Thank you.